Now let's head over to Uganda. With more than 50 deaths recorded since the outbreak of the Ebola virus in Uganda's central district of Mubende in mid-September, the government has extended COVID-style lockdowns in the country as the deadly virus continues to spread. The virus has since spread to 6 other parts of the East African nation, including the capital, Kampala. Recall that officials had imposed a 3-week lockdown on Mubende and neighbouring Kassanda on the 15th of October, which was due to end October 5th, but officials extended them for another 3 weeks.
Well, with the new directives, more than 400,000 Ugandans have been ordered not to leave their homes overnight or travel for personal reasons. Markets, bars and churches have also been closed. Well, let's bring in Bali Liela. She's the head editorial Spice Media Services in Uganda. Thank you so much for joining us.
You're welcome. Good morning.
Good morning to you. First of all, let's go straight into this pandemic, if you want to put it that way, because there are calls that there should be a complete and total lockdown. What's your take on this, and how are Ugandans reacting to this as well?
Basically, what I can tell you is the government has strengthened risk communication and community engagement, as well as safe, dignified burial of people who are succumbing to the Ebola outbreak back here in Uganda. For now, we all know that schools in Uganda are supposed to officially close for the end of the 2022 academic year on December 9th, 2022, which is almost a month from now. But yesterday, the cabinet even convened on Monday to decide on the fate of closing education institutions a bit earlier. This is because of the widespread of Ebola back here in Uganda. Recently, that is last week, the Ministry of Health noted that at least 6 Ebola cases had been recorded in one of the schools within the capital city of Kampala in Rubaga division. This is a great risk to several learners because there are many misconceptions and myths regarding the Ebola pandemic or outbreak back here in Uganda. But now, Dr. Joyce Moruku Kadichu, the State Minister for Health, yesterday asked Cabinet to at least make sure schools close a little bit earlier, such that learners get back home and the spread for Ebola virus isn't so much a lot within the learning or academic institutions here. But the Ministry of Health is trying to contain the disease, but just because some people are naturally stubborn or some do not really believe that Ebola is there. I'll give an instance here. A few weeks ago, there is a person who succumbed to Ebola in Kassanda district. A team from the Ministry of Health and the Red Cross conducted the safe, dignified burial of this person. But unfortunately, immediately the team left, the relatives of the deceased, 3 of them, embarked on exhuming the body to conduct a burial that they deemed fit for their relative. And these people also succumbed to the disease just a few days ago. So some people do not believe that Ebola is real back here in Uganda, which is becoming a very big threat to even the neighboring countries, because people are even, despite the lockdown that was extended in Mubende and Kassanda districts, people are sneaking out of the 2 districts using shortcuts to go into other districts.
Wow, that's really sad there. Reports have it that the confirmed fatality ratio amongst the case fatality ratio among confirmed cases is up by 37%. And you've mentioned about these misconceptions, unfortunately. I was going to ask you what effort the government is putting into ensuring that the citizens know just how serious Ebola is. Now, ever since it was announced, the index case was reported on the 20th of September. There were initial statements by the president saying that there will be no lockdown. Not too long after that, the lockdown was announced. Whilst the government, on the other hand, on one hand, is saying that there is a lockdown, and you're saying to us now that some people are not taking this serious, would you say that the government is putting enough effort into sensitizing the citizens about the effect and the importance of staying at home and the importance of protecting themselves against this virus?
One thing I can for sure tell you is people in Mubende and Kassanda districts, as well as other parts of the country, are struggling between two things: understanding a disease that they would only hear about in neighboring countries and probably in other parts of the country where we've had previous outbreaks. And then the other thing is they are struggling to really understand this disease and get to, have empty stomachs at the end of the day. So some people are weighing in. Do we stay at home and, fail to find something to eat? Or we have not to abide by the lockdown and go and look for something to eat to make sure that our families survive? So that is another big problem. So with this, government decided to even distribute relief aid in terms of food, maize and posho, beans, to some of the affected communities, especially those people that were greatly affected, especially like the boda riders, those who drive the matatus, the taxi drivers, as well as other people whose businesses were greatly affected by the lockdown. But unfortunately, these people still sneak out to go and conduct their activities. You even find some of them going to markets and shops to trade within other neighboring districts, which is greatly a risk to people from the neighboring districts. We've even seen parents who are sneaking from Mubende and Kassanda districts, going to other districts for visitation of their children. Last week, the Ministry of Health even told us that there is no more visitation of learners in schools, but surprisingly, candidates right now in Uganda are writing their final examinations. Today, the primary 7 learners have started writing their final exams. But surprisingly, many schools have not abided by this. They are violating the regulations. These schools are even going ahead to make sure that they hold prayers for the learners, which are, converging hundreds and thousands of people attending such prayers for their learners who are completing secondary school or even primary living education, which means there is laxity in emphasizing the regulations by the government. And this is a threat to the lives of millions of Ugandans who are at risk of contracting Ebola. I'm based in Hoima district, but one of the neighboring districts with us is Kagadi district. And here cases of Ebola have been confirmed. But surprisingly, people even trade from Kagadi to Hoima on a daily basis. They use the same cars, with a lot of passengers, and there is no regulations. People do not even want to wash hands with soap. Some even tell you they cannot afford to buy a bar of soap or, a piece of soap to wash their hands. So this is another challenge. Despite the fact that government is distributing food, but there are some other things that the government is also not enforcing. For example, making sure that people who are found sneaking into other districts are penalized or put into isolation centers is becoming hard. And even those put into isolation centers, surprisingly, are running away. We've seen cases where people are succumbing to Ebola in the central district, in the central or capital city of Kampala and other areas like Masaka district. And these are people who ran away from Mubende and Kassanda districts. So imagine they use public transport. How many people have they come in contact with from the time they ran away from Mubende to other districts?
That's a well-detailed information there. Thank you so much, Bale Nela, for that information. We really hope that people will take this serious, or there will be penalties, especially for those who flout the order of the government. No doubt it's also clear that Yoweri Museveni has done a whole lot to put things in place with his cabinet to ensure that people are safe. But we'll bring you back and you'll give us more updates, no doubt, because we believe in your research and your follow-up on this story. Thank you so much for being here.
You're welcome.
All right, so it's a whole lot going on in Uganda. Well, important fact has it that World Health Organization bosses say there is a high risk of Ebola spreading further and have called on neighboring countries to boost their preparedness. A few weeks ago, we talked about West African states like Nigeria, who have done a lot from the border control to ensure that as soon as you fly in, you're being checked. But the questions are still rising. Are these checks still ongoing? Well, there are no drugs or vaccines, by the way, proven to work against the circulating Sudan strain, which is Uganda, which is what Uganda is indeed facing. So no cure. Let's put it that way. No cure. So you might want to be extra careful, Olive. It's something I think we need to stress very carefully.
I think also the countries that share borders, with Uganda, now will be the time for them to also start to prepare. So we have the Kenya, the DRC, the Rwanda. These countries now need to start putting in measures and not just think, oh, it's happening in Uganda, it won't get to us. Because we know how porous a lot of borders are around.
If people are sneaking into buses and
exactly,
escaping.
you're sneaking into houses. So on the one hand, they do not see the importance of what is happening. But when we talked about this, the index case, the fears were that the index case wasn't the index case, and that the case that was reported as at the 20th of September wasn't the first, because the young man had been to a few hospitals and had been sick for a while before he died, and then they realized that it was Ebola he had died from. So the number of people he had intermixed with, those are the local gold mining local mining company, the Boda riders who do not believe this. And on the other hand, the effect of poverty. It's really very scary.
It is. It is really.